All right, thanks everybody. We'll go ahead and get started. Good afternoon. My name is Julie Babbage, and I am the Executive Director of the Diabetes Patient Advocacy Coalition, DPAC, and welcome to the Pennsylvania Diabetes Advocacy Forum. We work on federal issues, we work on state issues, and we've done a program today in 9 other states. So we're really excited to be coming here to Pennsylvania and working on legislative issues specifically in this state, because there is a lot of opportunity for some positive change, and you're going to hear a little bit more about that later. But we'll start just with who we've got today. In your registration, many of you noted your connection to diabetes, and we have folks from all across the spectrum, type 1, type 2, parents of children, friends and others who are interested. So thank you all for being here. And also about 70% of you indicated that you had not met with an elected official. That is until today, because we are pleased to welcome our legislative panelist, Representative Donna Oberlander, who will speak to us in a few minutes. And we'll go ahead and transition into our agenda. We will discuss how to be a diabetes advocate in Pennsylvania, as well as the key issues that we work on across the patient advocacy community. And we'll wrap it all up in less than 90 minutes. So we'll fly through some good things today, but you'll definitely have an overview of what diabetes advocacy looks like. A couple things to note: feel free to submit your questions in the chat, and we'll answer those as we have time. And let us know if you're having any technical trouble. We would be happy to assist you. And lastly, this meeting is being recorded, and it's also being cast to Facebook Live, so you can watch it again right after we conclude, and we'll also send that in an email to the folks who have joined today. I will briefly touch on DPAC. We're a nonprofit organization advocating on behalf of all 34 million Americans with diabetes, so type 1, type 2, parents, friends, colleagues. And specifically, our mission is all about advocacy, state work, federal work, making meaningful change in law and regulation so that people with diabetes can live long and healthy and productive lives. And DPAC formed because the patient voice was really missing in the halls of Congress and state legislators, and lawmakers and others really needed to hear from people with diabetes in order to be making the right choices, to be making decisions that impact them. So our work is focused on making it easy for you, your family, and others to advocate for diabetes issues. We have events like today. We have resources to help educate and empower everyone. We have also what we call Click Advocacy. It's a platform so that you can send a letter to your representative or others with just the click of a button, so that lawmakers and health leaders and others can be really informed on the key issues, but also in that process know and understand your story specifically, because that's often what drives them to vote a certain way or make a change. We're affiliated with, on the next slide, the Diabetes Leadership Council. They are the policy side of our advocacy-oriented organization, and how bills are written, what the bills mean, their overall impact. These are the types of things that DLC works on. And both of us partner with other organizations across the diabetes space to build consensus on action that has to be taken for people with diabetes. And like all states, we're going to talk about how diabetes specifically impacts Pennsylvania in a big way. Just over 10% of adults have diagnosed diabetes. Many more have prediabetes or are undiagnosed. There are also children who are not factored into this statistic. What you're looking at here is Medicare data by zip code. So you can see also there's a disproportionate impact in certain areas of the states. And we'll talk about that as well in the panel that we're going to get into. Diving into the policy discussion, we want to show you this scorecard, which is a list of bills that we see that are active across states. Many have filed these bills or are working on them or have passed them. This is legislation that DPAC actively supports. And we're going to expand on this later and what each of these means. But the main point here is that Pennsylvania, as you can see, has a lot of open boxes and the chance to make some significant strides. I want to touch on a couple, the copay cap and the copay accumulators. Those boxes are unchecked, but they are active bills in the legislature right now. And also in just a few minutes, I'll let Representative Oberlander explain that diabetes caucus box, which is checked, She is the chair, and she can tell us firsthand what a diabetes caucus even is, the work that they are doing. And I'll introduce our moderator now for that panel so that we can get right into that. So if they can turn on their cameras. Ed Hawthorne is our moderator for today's panel. Ed is the vice chair of DPAC's affiliate organization, the Diabetes Leadership Council. He is a former chair of the board for the American Diabetes Association and has served on several other boards, including the Red Cross and the March of Dimes. He is currently the COO and managing partner for CE3 Solutions. A champion for people with diabetes for decades, Ed is actively involved in the state of California, where he resides with his family. So thank you for joining us, Ed, and I will turn it over to you.
All right. Well, thank you, Julie. I appreciate it. And for today's panel, we are so grateful and excited to have a legislator and champion for health policy. First elected to the House in 2008, Representative Donna Oberlander represents the 63rd House District in Western Pennsylvania. During her time as a member of the House, Oberlander has served in various leadership capacities and last year became the second woman ever to be elected Majority Whip. She is the current chair of the Pennsylvania House Diabetes Caucus, where she works alongside her colleagues to promote legislation to help people with diabetes. And Oberlander has earned her bachelor's degree from Clarion University of Pennsylvania. So thank you so much, Representative Oberlander, for joining us today. And now diabetes, everybody has a connection of some point with diabetes, whether directly or indirectly. So can you tell us yours and why you work on this issue?
Yes, first and foremost, thank you for allowing me to be part of your panel today and to have this discussion. It is an honor and a privilege to join you. So my direct connection to diabetes, it came through my uncle, who died at the age of 49 from complications with diabetes. And it was a long, difficult process for him. He was diagnosed with diabetes type 2 when he was in his late 30s, early 40s. He didn't, it wasn't well managed, and through a series of really difficult challenges, he ultimately ended up with a wound that would not heal because of the diabetes. He ended up with amputation. And from there, it was a very long process in hospitals, in nursing home, until he eventually died of cardiac arrest because of those injuries that started all with diabetes. And so when the former diabetes caucus chair decided to step down, he asked me if I would be interested. And I said, absolutely, I would be more than happy to champion this cause and work with my colleagues in growing awareness and the issues that surround diabetes in the Commonwealth of Pennsylvania.
Well, first of all, we're so sorry about the passing of your uncle, and we all send our condolences to you and your family. So you've also sponsored HB 853 last session, which would offer patients protection from a practice that we call non-medical switching. Could you share more about the bill and your plans for it in this session, and how it might impact people with diabetes and other chronic diseases?
Absolutely. That is one of the bills that I am the prime sponsor of, with a number of other bills that we're working on. But that particular bill, I call it Contract 101. It's a plain language that if you have a insurance policy that you expect the coverage, you've done your research and you know that the coverage that you're looking for is part of that plan and you're paying for it, that you can't have the rug pulled out from under you midterm. And we've seen that from the diabetic community and a number of other areas, as you've mentioned, critical disease, critical care areas. And so we're fully intending to push that this year again. it will be, unfortunately, it was referred to the insurance committee, and it's really a consumer protection bill. And so in the fall, it will be re-referred to the Consumer Affairs Committee, and I'm working with other organizations and the chairman to get that moved along.
Well, thank you so much for your efforts on that. That's critically important for people with diabetes. The other thing, we believe that diabetes is a non-partisan issue, or it definitely should be. But as chair of the House Diabetes Caucus, you work with colleagues from different parties and different areas of the state to promote policy for people with diabetes. So could you tell us more about some of the caucus's recent work?
I would be happy to. As you mentioned, it is a bipartisan committee, a caucus. It's an informal caucus. We agree that diabetes isn't a particular party's issue. It's a human issue. And so I have a great co-chair in Representative Mark Longetti from Mercer County. We work closely together on doing certain caucus meetings. For example, we'll have in one of the pharmaceutical companies to talk about their particular product, some of the discounts and the affordability plans that they have for individuals with diabetes. We've had some of the hospitals in to meet with us to talk about, for example, I think it's called food pharmacy, and the programs that they're using with their diabetic community, not just the person who has the diabetes, but their entire family, to make positive changes and reduce the visits to the ER. Most recently, we were working with the Omnipod and the newer systems of insulin administration, and how those new technology is allowing individuals to swim and get involved in different things. And we found that it wasn't on our list, as it was called durable medical equipment rather than a pharmaceutical benefit. And so we've recently been working on that issue with the company to allow other more people to use those types of new technologies. So those are some of the things that we've worked on recently, but every year, with the exception of last year, we've also worked with the Diabetes Network and others to have World Diabetes Awareness Day. And we offer things to our colleagues to put into their newsletters to help draw awareness out in our communities with our constituents. And when asked, we're also part of things like this, so that we are learning more and we're able then to share that information.
Okay. And so, I have two questions. Julie will probably get mad because I asked one, but the issue around the pharmacy benefit managers, is that on your radar at all?
It is. Good.
Because that is a key and huge issue for people with diabetes.
I appreciate you bringing that up. I was really speaking off the top of my head. It's not my particular bill, but there is a PBM bill working its way through our House now.
Oh, great to hear. Can you tell us a little bit about what some of your other legislative priorities are for the caucus in this session coming up?
So one of the ones that I've been working on for the past 3 sessions, this being the third, is an obesity bill that would permit new medicine for obesity control. And we all know that obesity and diabetes, type 2 specifically, go hand in hand. This would allow other opportunities to address the obesity before you get to the point of bariatric surgery or some of the more invasive solutions. So this current session, it has passed the House. It seems to be more acceptable And quite frankly, in the past, the issue has been the cost. So we're looking at the fiscal note being more of an accurate depiction of what that would cost. And it's very challenging to include the savings, because when somebody doesn't have, they don't have to have an amputation, they don't have to have an extended stay. You can't put a concrete figure on that, but we know without a doubt that those types of things will be savings. We just have to figure out how to include that in that excuse me for rambling, but in that fiscal note, so that we can accurately address the cost and get the support to make that bill finally get across the finish line.
Okay, well, thank you so much. What are some of the, I guess I'd ask more broadly, what are some of the other health priorities that as whip that you're working to see move through the chamber, in addition to what you mentioned?
So I think that the biggest one, and kind of addresses the question of health equity, is telemedicine. And when you first brought up the map of Pennsylvania, I'm over on the western side in one of the dark sections. It's a rural area, but regardless of whether we're rural or urban, telemedicine and the opportunity for individuals to be able to access doctors and specialists is hitting a critical need. And so that a particular piece of legislation and allowing telemedicine to help address those issues is absolutely a priority, not only for myself, but for our caucus and for, I believe, our entire chamber. So we'll continue to work through some of those issues.
Well, that sort of leads me into the sort of next question for you about, as you know, that with COVID, that, as well as diabetes, has had a disproportionate impact on certain segments of the population. And we generally call this sort of health inequity. And how are you and other leaders in Pennsylvania working to address this for communities of color? And number one, and number two, how does that connect with the legislation that you pushed around telemedicine?
So I think it's a great question, and I'll just expand it to also socioeconomic, because it also impacts that as well. And so telemedicine is absolutely critical to addressing that issue. It also, and it seems unrelated, but they're absolutely related, is access to broadband or internet services. So if you don't have access, you don't have a computer, you don't have a ride to a doctor's office, if you do have a doctor's office close by, those are all areas that hurt the equity, and things that we can work to help increase the equity. So as is across the state and as is across the nation, there has been a great deal of emphasis on broadband accessibility, building that network out so that it is available in every nook and cranny of our Commonwealth and our nation. And I think that Pennsylvania is no exception. We are continuing to work on pushing that out, but that's not the only answer, because as I had mentioned, if you don't have access to a computer, it doesn't matter if broadband's right at your door, you're still not able to make that happen. So I do think that there's work to be done on creating hubs where individuals, maybe it's the city center. And when I say city, I live in a town of 6,000 people, so it's not really a city, but a place where most people go to grocery shop or to bank or what have you. Maybe that's the place where you could go and get the access to those doctors. We also have food deserts across our Commonwealth. And as I mentioned, I live in a rural area. People, I think that they have a picture in their head of what a rural area is, and that we have a lot of farming, and farming means that you have food. That doesn't necessarily mean that we all have access to the same good food, and the grocery stores that have fresh produce, or the farmers markets that have fresh produce. And I know that there's a growing interest in building out the farmers markets. We saw it through the COVID. People want to know where their food's coming from. They want to know that it's fresh and good, but that's also, you have to be able to afford it. And so the state has a great program for our senior citizens that give a waiver, actually a voucher, and they can go purchase those fresh products. I think that that's something that we can, continue to work on with the food deserts. And certainly I thought that the food pharmacy, where you have a medical system who understands the cost of having someone in the hospital, has not only to their system, but also to the insurance, to their lives, to their families' lives. And that particular example, I think, would be a great thing to replicate across our Commonwealth, where literally they're giving you food, they're teaching you how to prepare it, and they're teaching your family so that you don't feel like you're the outsider trying to eat good. So those are some of the things that I think would help with the health equity. And certainly we have work to do.
That's an interesting connection between the food and a connection with, sort of the medical side of it. It says that you have a medical need for good nutrition, and at least that becomes a start. And I really like the conversation around broadband access, and I think because some of us are really just don't understand where some of the rural areas just have no access to that at all. And if you're going to do telemedicine, and for that matter, general communications to be able to contact people about health, that becomes critical, as well as the need to have equipment. So as you know, you have broadband there, but if you don't have the equipment, then broadband doesn't do you any good either. So.
Exactly. I will just add that, the phone technology has helped. My father was able to access some of his doctors, some of his specialists that don't come to our area virtually through his cell phone. Okay. But it also added the other challenge of, he didn't grow up with that kind of technology. He didn't understand how to make that technology work. And so then you have to have individuals around you, a support system around you who can help you make, bridge that gap. And so, maybe those are some volunteer opportunities. Maybe that's something that happens in our community centers, our senior centers. So, I think there are lots of ways for us to interconnect and to help each other. And those are just some of the things that I thought as I prepared for today, and some things that are just popping in my head as we literally speak.
Well, you know what, we are really excited to hear about all of the work that you're doing in this area to support people with diabetes, but also people with other chronic diseases. And we could tell from your enthusiasm and passion that that's really what it takes to bring your colleagues on board too. So we appreciate that. And I have one last question for you, unless you have something else that you want to share with us before.
No.
Okay.
Nope,
so
that sounds good.
All right, so the last question is by just asking you from your perspective about what the best way for a smart advocate to help you and to work with you to engage with their representatives. Because we often hear that just a couple of people writing in can get to lawmakers' attention. So we just want to get a perspective from you.
Certainly, letters are a way to advocate, phone calls are a way to advocate, but really just the personal stories. And if you're able to make that connection face to face, it makes all the difference. I realize that, legislators are very busy and sometimes it's hard to get that meeting, but, as a coalition, as an individual who has that personal story, it really does resonate with us. I mean, certainly if I hadn't had the experience that I've had with my own family member, I wouldn't know all of the challenges that he faced in trying to manage his disease. I wouldn't have understood that 60% of amputation of a non-traumatic lower limb occurs. Those are types of things that I know because of my personal interaction. But if a mother or a brother or someone comes here and talks to me about the issue that they're facing, the challenges that they're having with, for example, the Omnipod, and they really want to be able to be on the swim team and they want to be able to do these things, I don't know that because I don't live that every day. And so I would suggest that, reaching out to those legislators and sharing your personal stories will go a long way. You do have great organizations that lobby the different issues. And I know that they're in the Capitol. I see them in the Capitol. I engage with them in the Capitol. But those who are not on the Diabetes Caucus, they need to hear directly from their own constituents who have that personal experience. And I think that's the best way to move the needle and allow that individual legislator to know what's actually happening in their community.
Great. Well, Representative Overlander, I just want to thank you so much for your time. I know that you're very busy, and we appreciate that because you're doing a lot of the work on behalf of people with diabetes. So I want to thank you so much for your time today, and I will turn it back over to Julie.
Thank you.
Yeah, thank you, Representative Overlander. I was just going to say thank you too. I really appreciate you highlighting the importance of sharing the personal story, which is really a theme for us today and such a key part of advocacy. We tell champions that stories are things legislators remember and can relate to. And just like you're saying, not everybody has such a personal tie to diabetes. Everyone's connected, but when constituents can really bring it home for a legislator, I think that's so important. And I love that you're working on telehealth. That's not something that we hear a lot of legislators talk about on our forums, but we know it's a major issue with COVID right now. And we know that a lot of state legislatures are working on it. And so coming from a rural area yourself, being able to be a champion for broadband access and all the good things that come from that is really exciting, because we work on telehealth really at the federal level as well, and the intersection of healthcare and diabetes education, how patients in rural areas can get training without having to travel too far, how it can all be covered appropriately. So really grateful for your work on that.
Thank you.
And yeah, it's great to know about your efforts too on across the caucus. And I love that you said it's a human issue. It's not a partisan issue. That's another thing we really like to explain and talk about as we really help folks to be diabetes advocates, that it doesn't know party lines, and so we shouldn't either. So thank you for your time. It really sets us up well for the rest of the discussion.
Terrific. Thank you for including me, and best wishes on the rest of your day.
Thank you so much. Thank you.
Thank you.
And thanks, Ed, for moderating with us. We'll transition now into the rest of our program, which is an overview on the state of Pennsylvania politics, from the congressional delegation to the state process. And I'll let our slides come up here. We'll start first with the congressional side of things. Like every state, Pennsylvania has a couple of senators and also a large share, a real advantage in the House of Representatives. As you likely heard, though, Pennsylvania actually was among a handful of states that lost a seat in the 2020 census. So that number has moved from 18 to 17 total representatives. And if you aren't sure who your representative is, you can use the link here at the bottom of the screen, which will take you to a website, and you can check that out. We'll move into as well just the diabetes caucus on the congressional level. So we heard a lot about it on the state level, which is great. Not every state has a diabetes caucus, so it's a real advantage for Pennsylvania to have its own group that is really devoted to talking about diabetes issues. As you heard Representative Oberlander say, it's the best representation, really, that diabetes is not partisan, because you have folks who are choosing to be part of the caucus. They don't have to be, they weren't assigned to be. They're opting in, and they're really using their time to focus on issues that are important for people with diabetes. So it's great, and it's great that we could have her as the chair on today. There's also a congressional diabetes caucus, and notably, it is the largest health caucus in Congress, and there are actually more members that are in the caucus rather than are not in it. So we're really proud of that. And one of the asks that you can make to freshman representatives in Congress, those who were just elected in the most recent election and started their term in 2021, is to actually join the caucus. So we have that Click Advocacy opportunity available on our website, and you can see if you're a person who qualifies because your member of Congress is new as of this year. I will transition us now into the state of the state politics. Pennsylvania is one of 12 states where there's not a trifecta. That means that a trifecta is something where the House, the Senate, and the governor are all held by members of the same party. But in this case, the governor, as you can see on the screen, is a Democrat, and the House and Senate majorities are held by Republicans. And the Republican majority, by the way, is not a supermajority. So that means that if they want to override a veto by Governor Wolf, the Republicans would need some Democrats to team with them to achieve that necessary 2/3 majority for a veto override. So it means that things are still, that there's not a total control of one chamber or another. And again, that means that we have a great opportunity to present diabetes as a nonpartisan issue. Pennsylvania legislators work year round. They are currently in committee sessions. So they're still convening, but in an informal way. And then they'll come back together for legislative days later in September when they can pass more bills and legislation. So it's great because we can work on these issues year round in Pennsylvania, and we can be active in following the news year round, whereas other states are just meeting for portions of the year. House members in Pennsylvania are reelected every 2 years, and senators half of them are up for reelection every 2 years. So their terms are every 4 years. And legislators are coming to state capitals with all different backgrounds. We just heard again from a representative specifically from a rural area, a representative that has certain constituents who have certain interests. So it's our job to help all of these legislators understand that as they have their own checklist of things that they want to work on, that diabetes is absolutely something that should be on that list. We'll move forward into, as we think about these issues and how legislators are thinking about them as well, how they ultimately become a law. And that is not an easy process. Bill from Schoolhouse Rock, you may remember, talks about how he's running across, and sometimes a lot of the bills die, and he's one of the lucky ones that ends up passing. But hundreds of bills are filed every year, and some, a very small portion, are actually moving through the process to ultimately become a law. But the big takeaway from this slide is that it is a journey, and that means that we stay vigilant and we stay patient and we stay motivated to really weigh in at every level. So from the time that a bill is first filed, it's then assigned to a committee, and that's an opportunity for us to weigh in and reach out specifically to those committee members. It may be in the education committee because there's an education component. It may be in the budget committee because there's a financial component. But that ultimately means that we're reaching out to folks, a specific group of them, and asking them to vote yes, sometimes no. And if a majority of the committee votes yes, it then moves to that chamber, House or Senate, the floor, where another majority of members have to vote on it to then move it to the next chamber, whichever one it didn't start in, to go through the exact same process. Then it gets to the governor's desk, where we can ask the governor to sign it or to veto it. So there are so many opportunities to weigh in and to tell your story, and that's really something that we want to be sure that you're taking away from today. Okay, now we're moving into part 2 of today, which is Advocacy 101, and we're going to get really deep into some of the issues you've already heard us touching on from that scorecard slide, but we're going to tell you a little bit too about our champions community and what a champion means. So DPAC has thousands of subscribers. We're really proud to have champions from every state. A champion, though, is someone who is beyond just indicating that they're interested. They're actually attending events, just like you guys attended today. They're taking action when possible on letters. You know, they're having friends and family join DPAC so that they too can be involved and we can increase our overall collective impact. So we're really excited to show you on the next slide that we have a really vast, what we call our advocacy army, people from all 50 states, and just want to drive home that we are a really strong community of advocates when we act together and get involved.
To everybody listening, as we close out, here's the message I want to leave with you. Advocating on behalf of people with diabetes, whether it's yourself or your family, is important. You need to be involved. If you're someone on insulin and struggling, do not ration your insulin. There is help. There are programs available. Some of them don't care your income level. There are opportunities available, and you can get those from either the DPAC or the DLC website. Ladies and gentlemen, diabetes is serious. It needs to be taken serious. And I encourage all of you to get involved and do what Julie's going to ask you to do here in a minute, because I can tell you, if we don't, it's going to bankrupt our healthcare system, and we're all going to be in trouble. Julie, thank you for the opportunity to speak today. George, as always, you make me look good, and I really appreciate it.
Thank you guys very much.
I was just going to quickly keep you guys on for just a second, because we've gotten so many great questions. Pennsylvania is ready to get going. I think we've gotten over like 15 people writing in right now, just which is great. And I love some of the enthusiasm that's coming through. It's not just coming from you guys, right? We've got a lot of people who are really eager to get going. A couple folks who asked specifically about how to be an advocate, which we're going to touch on here in just a minute. We got a good question from Nehemiah about what we're doing in prevention advocacy, and one of the things we're working on is the Treat and Reduce Obesity Act at the federal level, which is a way to get obesity medications covered that are FDA approved, and really stopping some of the worst complications of obesity, which include diabetes. But can you guys speak to prevention, education, and other? Yeah, go ahead, George.
I want to chime in on the TROA Act there, because I didn't mention it before, but the Medicare Part D Act that came into place in 2003 that made Medicare it gave a pharmacy benefit into Medicare. One of the things they specifically wrote into that, in addition to thou shalt not negotiate with the government, with the pharmaceutical companies, they said thou shalt not ever cover a weight loss drug, because the only weight loss drugs that existed in 2003 were fen-phen, were the kinds that were snake oil, that were killing people, causing heart attacks, etc. But they actually wrote it into the law instead of making that a policy that they can tweak as real life actual treatments and therapies are available. And they are today. There are many real life treatments available, and people on Medicare can't have access to them unless we get the law changed. So we've got to really work on that, because it does not take losing half your body weight in order to have it make a difference. Losing 5% of your body weight makes a significant difference in your preventing of complications in diabetes. And in some cases, if it's early on, you can actually reverse type 2 diabetes. So we really do care about that.
So George, let me, and neither one of us are medical experts, but we've both been around this for a long time. You talked about obesity, but that's a type 1 and type 2 problem. That's not just a type 2 problem. I mean, it is, type 2 diabetes is the cost driver for most states. And for Pennsylvania and Medicaid, I will tell you that it is the #1 thing they're spending money on. But it's also a type 1 issue, is it not?
It's I think 42% of the U.S. population have overweight or obese at this point in time. And it is impacting virtually everything. The largest risk factor is type 2, but it does, the more overweight you are, the more typically more insulin or less sensitive to insulin you get. So it makes it harder to control your blood sugars regardless of your type in that scenario. So we definitely want to support anything that's going to treat that and make it easier to handle and address your diabetes and manage it and get a better health outcome.
Well, and I only bring that up because I read a report where more and more type 1s are being diagnosed with obesity at the same time they're diagnosed with type 1. But obesity isn't a trigger for type 1 like it is type 2. However, Julie, to your question, we have long supported the NDPP program, which is the National Diabetes Prevention Program, which is a type 2 program It can be adapted to type 1, but it's a type 2 program, and it's not drugs. It is a learning experience that's taught many through the WISE and through the health departments in all 50 states about how to manage your diabetes, how to manage your weight, how to manage your food, how to do everything. It's not an exercise program. It's a learning program. And we've supported that for years. And we've made great inroads in most of the states on that and getting it covered by a lot of insurance companies. But once again, insurance, they tend to think, let's not cover this and we'll save money, rather than thinking if we cover this, that we're going to save money down the road. So
Right.
it's a tough thing, but it's always something we've supported. So prevention, and the big thing for us, Julie, prevention, free for everybody, insulin, CGMs, pumps, meters, other diabetes medication. Don't charge people for them. They will use them. You have better adherence. You have better outcomes. That's the biggest one I can think of.
Preventive coverage, yes.
Preventive
for people with
coverage.
diabetes.
Right.
Yeah.
Absolutely a major issue for us. And thinking about obesity and diabetes and some of the issues that we're working on right now and the interaction with COVID and all that we've been seeing, I was just going to point out too, in terms of our work on making sure that people with diabetes were appropriately prioritized for the vaccine. And that work continues today. We had folks from all 50 states signing off that letter. We're really, really enthusiastic. We worked specifically with the CDC because their guidelines only prioritize type 2 and not type 1. That was an error. And we're working similarly today to make sure that as booster shots are continuously being discussed and vetted and understood, that people with diabetes are again appropriately prioritized for the next round of whatever is coming. So really excited for that work. And that is prevention in terms of preventing some of the awful things that we've seen in this pandemic. So really proud of that.
Correct. And that's important. And, whenever something's coming out, because of our affected immune syndrome, we're more at risk. George and I are more at risk than the average person walking down the street. Now, I'm older than George. I'm almost 65 years old. So I'm even more at risk than George is because I'm older than George. So seniority has a benefit and a curse when you're talking about these kind of things that are coming down. However, when they prioritized it, I was not prioritized. I had type 2 diabetes, and my age in my state, I wasn't prioritized. I should have been, and George should have been because he has type 1 without the age. Now, George has less hair. He should have been prioritized.
Well, I dyed this gray so I could get early access to the vaccine. It didn't work, but I did it. I did it just for that.
Yeah. So, but you're right, Julie. You're exactly correct.
Now, the last thing I was going to say is just a major part of prevention, not necessarily the onset of diabetes, but of complications, is making things, as Stuart, as you just pointed out, affordable and accessible for people with diabetes. And so from our work to the senior savings model with the previous administration and the work that they did with everyone to be sure that a $25 insulin option was available, or $35 insulin option was available on covered plans. And with open enrollment coming right up, that's something else that DPAC is going to be really involved in, is making sure that people understand how to use Medicare Plan Finder, that they understand what is covered and what's not, that we can advertise that these options exist and make sure that folks are making the best decisions for themselves and their families. So just wanted to wrap it all up with that and say thank you again for coming on here and explaining all this to us. Again, if you've got some questions, you can keep sending those in because we can continue to answer those via the chat. But we're going to go ahead and wrap things up. Thank you to our panel. And pull back up these slides. Thank you both. Thank you. So a great question was, okay, so what next, right? Well, how do I actually become an advocate with DPAC? And we're going to talk about just that. So you see here on the slide that from taking action at the state and the federal level, DPAC is working as hard as we can to make sure that we're following the legislation that matters most. And there are, as you saw, a lot of opportunities in Pennsylvania. So we can be sending out alerts, make sure you're subscribed, make sure that you're following us on social media so that you can send the click advocacy. If you have relationships or conversations already with your state lawmakers or with your federal representatives, then let us know and keep us apprised of those conversations so that we can also take advantage of that and make sure that diabetes is on the radars of those leaders, and also attend our events. We have, George mentioned that we're having a brown bag coming up, which is where instead of flying through the content like we did today, trying to get everything covered in an hour and a half, we dedicate one topic and half an hour to really dive into something that is complex. And Medicare negotiation is highly complex and incredibly relevant and timely right now. You might have seen that the infrastructure bill was going to have a component, could have a component, and there are more and more we're seeing in the community and hearing from champions who want to discuss certain topics that's a high priority for everybody. And to that end, please submit to us either in the comments right now or by email or through social media and messaging us what it is that you would like to really understand better. That maybe it was a topic we discussed today. We have videos up on YouTube of our past brown bags that you can watch. You can also join us for advocacy days. So we are about to announce our Hill Day for this year. It's going to be virtual, and you see some photos of folks from past Hill Days right there, where we're going to have anybody who is interested sign up and coordinate meetings with your congressional representatives in group settings on Zoom, and have conversations about very specific laws that we're working on, bills that we're working on that we would like to become law, and other action that we think is important or education that we think needs to be shared with these congressional representatives and senators. So please look out for that. We will be announcing it very soon, the dates and coordination and all that is for that. And it's a free event. It's really exciting, and it's a great way to really hone the skill that we are practicing today and that you're practicing by being an advocate. And then the last part is just to continue to be patient. Government doesn't always move as fast as we would want them to. So just another note for you. And most importantly, tell your story. We heard Representative Oberlander emphasize that, and it is so important just to say again that a lot of people are connected to diabetes. We know that, we use that to our advantage, but there are lawmakers who are not in the caucus. There are lawmakers who do not have a family connection, who don't know how much it's impacting their constituents, and to be able to explain it succinctly, briefly, passionately, respectfully, those are all ways that we're able to build bridges and conversations that can really take us to the next level in terms of what we're able to accomplish. So be sure that that's something that you take away from today, that your story matters, that telling your story matters, and then these next step checklists to sign up to be an advocate and follow us on social media. Again, you see our handles right there. So thank you again for those of you who joined us on Facebook, for those of you who joined us on Zoom. We were so grateful to come to Pennsylvania. Thank you for the extra participation that we got. And we're really looking forward to continuing and boosting our advocacy efforts specifically in this state. So thank you and have a great rest of your day.